Good evening, everyone. Thank you for joining tonight's webinar. Our webinars are recorded via WebEx and will be made accessible online after the session. Now using Cisco WebEx Event Center, if you're having trouble joining, log out the session and rejoin through the link sent to you earlier by WebEx or by entering the meeting room number 577-336-425 and password is Sri Lanka 123. Your mics are muted throughout the meeting, but you can chat your thoughts to us through the chat tab. And for your questions, please type them in the Q&A tab. Tonight we have two speakers. Our first speaker is Dr. Roshan Hewapatirana. He is currently a PhD Fellow of the Department of Informatics from the University of Oslo and has acquired academic qualifications in medicine and information technology upon entering the field of health informatics. Dr. Roshan is the Chief Executive Officer of the Health Informatics Society of Sri Lanka. He is serving as course coordinator of the Masters in Biomedical Informatics program and a visiting lecturer in Postgraduate Institute of Medicine, University of Colombo, Sri Lanka. He is involved with several undergraduate and postgraduate teaching programs as a research person in health informatics. He is an editor to Sri Lanka Journal of Biomedical Informatics and a reviewer for the Electronic Journal of Health Informatics. The second speaker is Dr. Clive James, who obtained his medical degree from the University of Petersburg. He worked as a medical officer in various disciplines, including surgery, medicine, pediatrics, gynecology and obstetrics, and cardiology in hospitals under the Ministry of Health. He was selected to pursue his postgraduate studies at the Postgraduate Institute of Medicine, University of Colombo, and was awarded the Masters of Science in Biomedical Informatics in 2009 by the University of Colombo. Since 2009, he's been working as a medical officer of health information management at the Management, Development, and Planning Unit of the Ministry of Health. He is also employed as a project officer to the Second Health Sector Development Project at the World Bank. We will now call on our speakers.
Here to present monthly country health updates on behalf of Sri Lanka. I'm Dr. Roshan and my colleague Dr. Clive James is here with me. I'm representing Health Informatics Society of Sri Lanka, and Dr. Clive is representing Ministry of Health. So in Sri Lankan context, for the state health sector, Ministry of Health is the main player for health information and computerization. And in this picture, Health Informatics Society and various other partners acting as supporting.
Dr. Roshan? How do you share your screen?
First, I will introduce ourselves and then I will give the microphone to Dr. Clive, and then I will go to my presentation. Will that be okay?
Yes, no problem.
Okay. Now, as I discussed just now, the Ministry of Health is the main driving force for the health IT and the computerization projects. Everything is happening under the scrutiny and the planning of the Ministry of Health. So all the other partners are very supportive entities for this computerization. And Health Informatics Society is one a key player supporting Ministry of Health, especially the Health Information Unit, which is the responsible unit for computerization and enabling IT in the state health sector. There are several other partners like Information and Communication Technology Agency of Sri Lanka, supporting these various activities and also some development partners as well. So on behalf of Sri Lanka, I will invite Dr. Ssytems to start giving an overview of this from the ministry side and what are the key areas they have been initiated this computerization as well as different projects. Then followed by that, I will present the role of Health Informatics Society and different other partners that their involvement in this picture. Okay, Clive.
Hello, hi, Cha. Are you there? Can you hear me? Hello?
Hello? Yes, I can hear you.
Okay, is my screen on? Is the screen on?
Yes, it's on now.
Okay. Good evening, everyone. And thank you for having us here today at the AEN Hour. I think the first 10 minutes I will just briefly brief you all through some of the activities that the Ministry of Health is carrying out to digitize the healthcare sector. I will break it into like 5 main areas. Now, if you look at the health information systems, what we are doing here at the moment in the state health sector is, of course, EAMR is something that you already know what is happening. It has been going on for about last 3-4 years, but now it has always been implemented in about 200 hospitals. It is basically tracking our morbidity and mortality record, and then there is a system called WebIS, which is a web-based immunization tracker, which is now implemented in about 40 main hospitals, and these 40 main hospitals are responsible for about 75% of our hospital births. So which means this solution is already capturing most of our childbirths, and immunization of the children is being tracked through this solution. Then we already also have a hospital health information system, which is still focused more into the outpatient and OPD, but it is also now being developed to address inward patients, and there are also gradually many modules being developed to it to enable it to function more smoothly in laboratories and also in the ICU setup and ETU setup and so on. And there is also a key factor that is we note out of these 3 main solutions that we have also made sure taken one hospital as a pilot site, and to see if these 3 solutions can be interconnected and also exchange data in between them, that so these 3 solutions don't function in silos in a particular healthcare institution. The institution chosen for that was a premier child and maternity, actually maternity hospital called the Castle Street Hospital for Women Healthcare in Colombo, where all 3 of the solutions are implemented. The hospital health information system comes in at the admission side when the mother is admitted to the hospital, and then the WebIS comes in, starts its function from the labor room when the child is delivered at the labor room, and then when both are discharged, the records go into EAMR. And at this hospital, to prevent double entry into these solutions, we have made sure there is a back-end interconnection between these solutions. And then there's another main, I'm only talking about some of the key activities that are taking place. I'm not talking about the main activities that we are currently undertaking. And we are also undertaking a role to implement digital imaging in some of the key hospitals, 3 teaching hospitals. So PACS together as a system will be implemented in some of the, I think, 3 or 4 main teaching hospitals in Sri Lanka. And then when it comes to the management aspect of the healthcare, human resource management solutions have been there. For example, there has been a sort of a legacy system that has been existing for about now 6-7 years, and there is also a new system that has been implemented specifically to handle human resource of a certain category of medical officers. But now these solutions both are being looked at in a way to scale it up and comprehensively handle the entire human resource of the health sector to be handled through this solution. And also now we are trying to develop a project management solution to look into the projects that we are undertaking. Then One Health tool, which is a WHO open source tool for costing, has also been used to cost some of our programs. Then when it comes to the governance aspect, where I think the health information unit is mainly involved.
Hello, Dr. Clive? Hello, Dr. Clive, can you hear me? I'm sorry, everyone. I think they're having some technical problems on their end. Hope you can wait for a few minutes.
Telecommunication telco company in Sri Lanka, which launched a solution called Dr. Telke, is also now issuing the personal. Hello, Shah, can you hear me?
Hello, Dr. Clive. Yes, I can hear you now.
Okay.
Thank you.
Which part did you all miss? Did you all miss the previous slide or?
Can you repeat a bit of this slide?
This slide, okay.
Yes, thank
Okay,
you.
the previous slide was about the solutions we are actually the health information solution. Now these three main aspects are actually two solutions that are implemented in the management system, mostly in the administrative aspect of the healthcare. So we already had a human resource solution that was being implemented for about last 6-7 years, and we also created a new solution for only specifically for the medical officers. Now these two solutions are being looked at in a way to upgrade themselves and more comprehensively to handle the entire human resource of the Ministry of Health. And then a project management solution is now being created to monitor all physical or financial progress of all the projects that are implemented in the health sector. Then we have also used the One Health tool. Of course, many of you all know the free and open source tool by WHO, which is being used to cost some of the programs that we are doing in the health ministry. Then I go to the next slide, which is about governance, what we are doing, and this is where the health information unit actually plays a major role. I think when it comes to governance, the national eHealth guidelines and standards is already officially been approved by the ministry and is officially out, but we are yet to ceremonially release it. Then the information policy is also got its ministry approval and awaiting translation and also cabinet approval to be released in the near future. Time to time, as the health information unit, we have been issuing circulars to streamline the health activities. The recent most circular that we issued was to all health state institutions to let us know of any software solutions that they are trying to implement and get prior approval from the Ministry of Health before implementing any software solutions. So with this circular, I think a lot of hospitals have been writing to us in their concerns about trying to implement queue management system, laboratory management system, which is now actually prompted us to create the software registry. And with this, we are also trying to create the health institution registry. Then the personal health number has been there, is still not implemented nationally countrywide, but it is the unique numbering system that is to identify all healthcare seekers in Sri Lanka in a yeah. Hello?
Yes, hello, we can hear you, Dr. Clive.
Okay, right, fine, thank you. So the personal health number is now being used in about 18 state healthcare institutions, and one private institution also using it, and a premier telco in Sri Lanka, which implemented a solution recently called Doc.lk, is also using the same numbering system to identify the healthcare seekers. So we are also in the process of piloting a master patient index. If the master patient index pilot is successful, then probably we will go for a nationwide master patient index, and then of course issue the personal health number to every citizen in the country who seeks the healthcare. Then the eHealth steering committee has now been reactivated, which was I think dormant for about last year or so. So this is what we are mainly doing in the governance aspect. And then to all this, I think connectivity has been a big issue to all of us, especially in large institutions where we really wanted very powerful LANs. So now there is an initiative in about eight large healthcare, mainly the National Hospital and some of the premier teaching hospitals, to have fiber optic local area networks, because this has been a very big red tape and a bottleneck for implementation of healthcare solutions in these hospitals. And added to this, then we have also been lacking a very strong network backbone in Sri Lanka to connect all our healthcare institutions. So we want to have land in our institutions, and to connect these institutions, we need to have a good backbone. Luckily, the Sri Lankan government has now come out with a digital health plan and a digital infrastructure plan, which is going to connect about 1,500 state institutions to a premier, I think, fiber backbone. To that, they have identified initially to connect 300 healthcare institutions. I think this will be a big bonus for us and give us a big leverage to implement our solutions. So we don't have to actually worry about going to the cloud, and we could actually transfer data within our own LAN and wide area networks. Then when it comes to capacity building, which is also a main part that we have been focusing, because we have seen that many of the initiatives that we have taken up have not been carried forward because of lack of capacity at different levels, at the minor staff level, at the nursing level, at the midwifery level. So the Ministry of Health, starting from its head office, starting from the minor staff to the clerical staff, the administrators, has been carrying out ICD training. And every the training to normal staff is in different categories. Of course, normal staff gets the basic training. Then whoever is the technical staff gets more advanced training to be able to repair the computer in the unit to do basic troubleshooting. Then there has also been specific ICT training that has been carried out with assistance of universities, ICTA, HISSL, and so on. For example, network administration courses, ICD coding, mortality coding, procurement in the ICD sector, web content management, and lately not least, of course, we are just for the first time, Sri Lanka is training two of our in-house professionals in tax. They are currently in the United States getting trained, so this will be a big bonus point, and then we will have our own tax experts. At the moment, the lack of these capacities being a really sort of dragging us back, where we have to depend on external capacity, so this will help us to build these sort of initiatives, trying to build our own capacity. I think that is basically it, what is happening in the Ministry of Health, and I'll be glad to take over any questions, maybe during the question answer sessions. Thank you. I think Dr. Roshan will now take on from here. Okay.
Hello, Cha. Hello.
Yes, Dr. Roshan.
Yeah. Sorry for the delay. Now we have just heard what's the basically what are the activities Ministry of Health is doing and planning for the future. So let me present you as a partner what we or the Health Informatics Society is doing in the current eHealth context in Sri Lanka. So let me start with introducing what is the HISSL or HISSL. So HISSL is Health Informatics Society of Sri Lanka, which is a collection of Sri Lankan medical health and IT professionals, academics, and students who are interested in medical and healthcare informatics. So there's one special strength in HISSL, which is health informaticians who are the medical officers and dental surgeons in health informatics who are the part of this ministry workforce. So Dr. Clive is one of the proud member of that cohort. And so as I just mentioned in the beginning of this presentation, HISSL is a main technology partner to the Ministry of Health. So in this context, our contribution, or this contribution can be divided in basic few areas. The capacity building, research and development and information system implementation activities, knowledge dissemination, and one other very new initiative is Sri Lankan Community Interoperability Lab. And there are several ongoing regional and global partnerships we are conducting to uplift the Sri Lankan health IT landscape. So let me next take one by one and explain what are the activities we are doing within Sri Lanka and even regionally. For the capacity building, Dr. Clive also mentioned about this biomedical informatics program, the postgraduate Institute of Medicine, which produce the key workforce of the medical officers and dental surgeons of health informatics to the Ministry of Health. So the HISSL is supporting this training program, and in fact we are currently working on taking this program to the next level as well. So strengthening the very unique layer of medical officers and dental surgeons who are capable of
Excuse me.
Hello?
Yes,
Sorry? Can you see? Yeah, I'm sharing slides through Dr. Clive's machine. So, like, I have already shared.
Can you try sharing?
Yeah, I am already sharing. Now I'm presenting through Dr. Clive's machine. So,
Okay,
have you enabled?
It's not showing.
Yeah. Can you see right now? Clive, can you see that?
මට එන්නේ. මම හිතා ෆෝන් එකේ එන්නේ කියලා.
No. No. Hello, sir. I think now continue slowly, right? Hello, sir. Yeah, sorry for the technical difficulty. Yeah, I'll go through quickly what I have presented. So, as I discussed, I presented the HISSL is the Health Informatics Society of Sri Lanka, which is main technology partner for the Ministry of Health. So we are a collection of various medical, health, like IT and academic professionals who are interested in health and health informatics, different research, implementation, and different activities. Within the membership of Health Informatics Society, we have this unique layer of health informaticians or medical officers and dental surgeons of health informatics, who are again a part of the workforce of the Ministry of Health. So that's one main strength we are having to the Health Informatics Society. So I have broadly categorized these activities under capacity building, research and development, and information system implementations, knowledge dissemination, and the Sri Lankan Community Interoperability Lab, and regional and global partnership. We are currently conducting with different universities, development partners, and various other entities such as eHealth. So if I briefly go through these capacity building activities, we are, as just mentioned, we are supporting this biomedical informatics program of the Postgraduate Institute of Medicine, University of Colombo, to produce the medical officers and dental surgeons in health informatics, which is a main strength for the ongoing eHealth activities in Sri Lanka. And apart from that, we are supporting training of the other health categories also. In general training, as well as some project-based training as well. And to support ongoing eHealth activities, there should be this awareness of eHealth and standards, best practices kind of thing should go to the other layers also, which is involved with the eHealth implementation. So we have taken several initiatives to train the non-medical people also about, make them aware about the best practices and what are the issues they have to sort of face and provide solutions such as ethical considerations, specific standards and the interoperability measures, that kind of a thing. So there are several programs we are planning to launch, as well as we have started this Sri Lankan eHealth Tower. We were discussing especially we started that last year, and we were able to discuss several key initiatives and some important aspects of eHealth, which is a step we took to bring this health informatics matters beyond the regular group which is involved with the eHealth activities. So if we move to research and development and information system implementations, we have started several research activities with local and overseas universities. For example, with the collaboration of Postgraduate Institute of Medicine, hello, Cha.
Yes?
Can you hear me?
Yes, Dr. Rizal.
Okay. So I just mentioned that so we have these local research activities we are doing with Postgraduate Institute of Medicine, and there are several other overseas universities also have initiated different research activities, especially the areas of nutrition, child health, and child development with Health Informatics Society, and with the ministry and some of the development partners. With the help of the development partners, we have implemented R&D and information system implementations on the maternal and child health, non-communicable diseases, leprosy, tuberculosis, and respiratory disease control, kind of a different health programs and health activities. And in this R&D and information system implementations, we mainly focus on open source technologies and taking beyond this to the cutting edge latest development of the health informatics or health information system field. Now we have moved into the mobile application development as well. Apart from these public health information systems I have just mentioned, we have now initiated health information system project as well, which is based on OpenMRS, sort of OpenMRS customization to Sri Lankan requirement. And then I move to this knowledge dissemination activities. One thing I haven't mentioned here is the local eHIN hours or Sri Lankan eHealth hour we have been conducting from last year. And apart from that, annually we are conducting a conference. So last year we conducted it as eHealth Asia 2015. And then with the success and with the partnership of various regional and international partners, for example, last year the eHIN was supported us in every aspect to succeed this eHealth Asia 2015 conference. And this year actually with the collaboration of Commonwealth Medical Association as well, we have conducting the same conference under the title Commonwealth Triennial Conference. And if you go to CMA 2016 org, you can see more detail about the conference, and you'll be able to even contribute by the publications as well as a resource person to the conference. And the other activity, the key activity we were doing was this the journal, Sri Lankan Journal of Biomedical Informatics, which we have been publishing for several years. And now we were thinking of a regional journal as well, so we will announce that in near future. So our aim is to improve and facilitate the research as well as publication from the regional colleagues, so that especially the new researchers who are entering to the field. So that's our main concern, to guide them and facilitate them to this health informatics arena. And then let me move to the latest activity we have started with the partnership of Asian communities, the community interoperability labs, and so HISSL is mainly managing the Sri Lankan interoperability lab with the partnership of Ministry of Health and the industrial partners, as well as Information and Communication Technology Agency of Sri Lanka. So this is basically targeting to facilitate the discussion between various stakeholders, especially the health information system implementers or the service providers. So within this, we have initiated several research and development activities and health information system interoperability discussions, because we believe there should be a discussion between different stakeholders to achieve this interoperability in a successful manner. And we have conducted two sessions of OpenMRS training on eHealth WebEx platform. That was one of the very successful programs. So we conducted that as one activity of Sri Lankan Community Interoperability Lab to share our knowledge with the regional partnership. So that was done with the collaboration of eHealth as well as the global OpenMRS community. And to conclude it, I would like to summarize what are the main partnership we are maintaining with different partners. The key partnership we are having is with the Ministry of Health, facilitating the implementations of national plans, and the other technology partner is Information and Communication Technology Agency of Sri Lanka. And there are we have working with two key open source communities, DHISSL and OpenMRS, and several international partnerships such as International Medical Informatics Association, APAMI, Asian eHealth Information Network, and Commonwealth Medical Association and Indian Medical Informatics Association, kind of entities who are working for the improvements of the health informatics and related areas. And there are many industrial partners and the private sector partners working with us. Mainly we are supporting them on health information standards and design architecture, kind of a very specific technical areas, and this partnership results some very innovative solutions as well. And we are working very closely with several development partners also to improve the health landscape in Sri Lankan state health sector. So that is the basic outline of activities Health Informatics Society of Sri Lanka is carrying out. Now I think Clive and myself, we are ready to discuss any questions or clarifications from the audience? Thank you.
All right, Dr. Clive and Dr. Roshan, thank you. We have questions from our participants. Our first question is from Dr. Alvin. He's asking, is there a plan in Sri Lanka to put up an HIE?
Sorry, sir, can you just repeat the question?
The question is there a plan in Sri Lanka to put up an HIE?
Okay.
If you want to know about, is there a plan to put up a health information exchange platform?
Yes.
Yes, to start, we were discussing with different partners this health information exchange layer. So I think Clive just explained their initiatives from the policy side. Then HISSL as well as Information Technology and Communication Technology Agency. And we had several discussions also with Ministry of Health. So I think we are in the process of drafting the basic the initial plans for this interoperability. Clive, do you have any?
No, that should be fine.
All right, thank you. We have already a question from Dr. Alvin. The question is, which entity might be the steward for Sri Lanka Facilities Registry, Client Registry, and Provider Registry?
Yeah, I think the Health Information Unit of the Ministry of Health will be the main focal point who will be handling all the registries. Actually, the main three registries, which is the Facility Registry, Patient Registry at least, and the Software Registry, and so on.
All right, thank you. We have a question from Dr. Fazila. Dr. Fazila, would you like to speak on your microphone?
Hello? Can you hear me?
Yes.
Here, Dr. Fazila.
I want to find out about your Patient Master Index. So, is that a unique health number for nationwide? That means you don't have a national ID?
No, we have a national ID. We have been having, Sri Lanka is one of the countries there is a very, very good civil registration system in the region. And we have actually been the first countries to implement national ID. But this is a national healthcare ID. Right? So we have Sri Lanka. We have come to the conclusion that national ID will be used for all the other purposes like vehicle, bank transaction, and so on. But for the purpose of healthcare, we'll be using a separate ID.
I see. So all your systems in the hospitals and clinic uses this ID?
Yes.
Oh, okay.
Not at the moment all. At the moment, about 20 government hospitals and about one private hospital and all the other solutions are using this ID. ID is called the personal health number. That is the ID. That is the ID the healthcare seeker gets.
Do they get a card?
Yeah, at the moment they're getting a card, but the card they're getting is at the moment is a first generation card, which only has a barcode. But now the next step is for us to actually implement a master patient index and see how successful that is together with the PHN. And once we find that out, then we will roll out a third generation card, which will have the capacity to store some data in it also.
Okay, thank you.
You're welcome.
All right, thank you. We have a question from Dr. Sambat. Dr. Sambat, would you like to speak on your microphone? No, Dr. Sambat. I think also Dr. Simbat is asking, what is One Health tool? It's used in eHealth. Can you share it with us?
No, it is not direct. You cannot call it a eHealth tool. It is, I think, your ex-regional director, Mr. Mark Landry, who is now working for Seiro, has a very good idea because he had worked with the founder members of One Health Tool. One Health Tool is an open source solution, basically now sort of customized to cost your healthcare programs. Let's say you have a vaccination program in Cambodia and you want to cost your vaccination program, how much you spend on your vaccination campaign in Cambodia. For Dr. Samrat, let's say how much you spend on human resource, your cooling, your logistics, your transport and everything. So this is one of the tools that help you cost your program. It is now promoted as like a gold standard tool by the WHO. So WHO has now taken ownership of it and it is promoting it. And it's you can openly download it and sort and run it.
Okay, thank you. There's another question from Dr. Sambat. The question is, how did you link the patient's master index with hospital information system?
No. At the moment, we have not done the linkage yet, right? What we are planning to do is to link 4 hospital information systems to a master patient index. We are planning, but at the moment we are not done it. But if you want to know how we are going to plan to link it, of course, the technical aspect, I am not the professional to explain it. We are actually trying to get all 4 hospitals to use the health information system, and through the backend, then the health information system pushes data to its own database. It will push a certain amount of data, let's say the patient age, name and all that, to the master patient index, the central database, and also the query can be done from there. So it's a technical aspect of doing it at the back end. Prashant, do you want to add anything to that?
Our design is basically based on a health number that I just mentioned. And in our design, each hospital should be able to work independently from their end, as well as the design should be robust to withstand the network breakdown and the kind of physical as well as connectivity issues aspect. So the design is basically to limit the shareable data to a minimum so that it won't affect independent activities of hospital, as well as there's no need to share all the information because the design is based on current clinical practice in Sri Lanka state health sector. The current what we are doing is issuing discharge card to the patient. So this is the idea behind the computerization effort as well. So the middleware and this master patient index, we are still researching what should be the best tool to use. There are several middlewares we were thinking of, like the famous WHO2 enterprise service bus, and we are evaluating different master patient index architectures with this to decide what technology solution we are going to use for this purpose in the long run. I think we answered some of the questions.
Okay, thank you, Dr. Rosanna, Dr. Clive. We have a question from Engineer Derek. Engineer Derek, would you like to speak on your microphone?
Hi, everybody. I hope you can hear me. My question is about the web-based immunization system. I'm curious to know whether or not that is collecting statistics only, or whether or not that is also used to track vaccine management for each child and even vaccine inventory management. So is it an immunization registry, or is it collecting statistics alone?
It's an immunization registry, no? Yeah, hello, yeah, thank you for the question. It is actually operating as an immunization registry. It's just not for statistics, it collects data and it also tracks the immunization of the child. And also this is the solution now providing data about the birth to the Registrar General's Department in Sri Lanka also as a validation measure.
Can you just describe quickly how is it used? Is it used at the facility? So does it capture births in facility, and is there also an interface to capture births in the community? And also, how do you do identity management for each child, so you can track which vaccines that each child has had? Are you assigning an ID right at birth?
That's right. Now, in Sri Lanka, almost 99%. In Sri Lanka, we are almost 99.5%. We have hospital births, unlike other countries in the region. Hello? So we very rarely have community births. Can you hear me?
I can. That's fantastic.
Right. So with all the hospital, almost all births happening in hospitals, we capture data right. The data is fed into the solution right at the labor room, so where the child is delivered. Right. Even before the child is given a name, but the child is issued a personal health number. And pasted on the child.
Is this a durable number?
Yes.
Is it taller than that?
Yes, because at the birth in the labor room, the child is issued until 5 years something called a child health developmental record, CHRD. The boys, CHDR, child health development record. This PHN as a sticker is pasted on the CHDR, which will travel with the child, the record. Right, and then when after 4 or 5 days, after a week, when the parents name the child, the solution will capture the child's name back into the solution, and then using this personal health number, this child could be tracked.
That's good.
In the clinic also you can do this. They have a solution in the clinic also, the child could be tracked. I can actually post an image if my desktop is being shared. I can post an image. I'll try to share my desktop. I will now share an image of a CHDR which is having the sticker of the PHN. I will try to do that now.
May I also just very briefly ask vaccine inventories?
It does not. I think it does not track vaccine inventory. It does not.
Okay, thank you.
All right, thank you everyone for participating in this webinar. We would like to thank our speakers, Dr. Rashan and Dr. Clive, for sharing their time with us. For the questions that we were not able to address, we will send the questions to our speakers and post the answers together with the materials of this session. Thank you for attending, everyone. Please anticipate the upcoming eHealth Asia on October 14 to 16 at Cinnamon Grand, Colombo, Sri Lanka. Thank you, everyone. Good night.
Thank you, everyone. Thank you, Cha, for the invitation. Thank you for having us. Good night.